It is summer, it is vacation time, and the pandemic seems to be everything but over. If you look around over the past weeks, more and more stories are emerging from people who were infected with COVID, family members, neighbors, co-workers. And this at a time when people are about to travel on packed airplanes and trains to go to crowded beaches and resorts. Health officials are already worried about the situation in September. What could be a better moment for a discussion named European Health Policy Recommendations for the Future? Hello and welcome to our live debate in cooperation with the European Health Parliament. I'm Stefan Grobe, and I'll have the great pleasure to talk about the health situation with four first-rate guests whose job it is to think about how to make things better. And by the way, I'm sitting in for a Euronews colleague who just got COVID a few days ago, so this is a real-time experience for all of us. But let's get started and bring in our panel. To my left, Sandra Gallina, Director General of Health and Food Safety at the European Commission from Italy.
Good afternoon.
Next to her, Tomislav Sokol, member of the EPP group here in the European Parliament from Croatia, member of the Special Committee on the COVID pandemic and member of the group MEPs Against Cancer.
Hello.
Welcome. On my left, Anca Toma, Executive Director of the European Patients Forum from Romania. And on my extreme right, so to speak, Eleonora Vartumian, President of the European Health Parliament, Board Member at the Institute of Cancer and Crisis, and a Senior Health and Policy Officer at the European Cancer Patient Coalition from Greece. Now, welcome to all of you, and thank you for joining me. What I want to do first is ask you about your sense of the current state of affairs. Is COVID under control or not? Are our health systems resilient enough? Are we prepared for new waves? And Sandra Gallina, I'd like to start with you. You are in charge of the European Commission's Health Department. What is your take on the current situation?
I would immediately say that it's under control so that people don't start panicking. However, we need to start learning to live with COVID. And this is what we have not learned yet. So for me, these days are a bit groundhog days because, we had last summer the same situation. We relaxed measures and infections peaked. May I say that for as long as the vaccines do not have, as what we say in jargon, perforations, meaning that they still hold good, and for the time being this is the case, we will not have an increased pressures in hospitals, which is what also causes a chain effect on other diseases, which I hope we will touch upon, given that the Honourable Sokol is a leading light on cancer, a flagship initiative for this mandate. So for me, the situation is under control for as long as we also exert some sort of attention to the fact that COVID is amongst us. If you don't feel safe, just wear a mask in a plane. It's not an obligation, but if you feel safer with a mask, FFP2 masks, please, because other masks is not necessarily so useful. For the rest, I do believe that when you are having contact, you need to be really responsible. And stories which I heard on the press about, I would say, tennis players not declaring themselves, or criticism of those who say, I am sort of infected, I will not play, this doesn't work. So I think we all need to be responsible. If you have some symptoms, do a test, possibly a PCR test, and then participate in normal social life without being too anguished. Angst about COVID will not give us good results, but responsibility and attention will.
All right. Tomislav Sokol, you're a doctor yourself, you're an expert, all matters health-related. You just heard from Sandra.
Actually, I'm a doctor of health law, so I'm a lawyer by original profession.
Okay, but that's already something. Now, you've heard Sandra Gallina say that we have to live with COVID for a long time. Is this a matter of years? And is it 5 or 10 years? Or what is your perspective on this?
Yeah, I mean, it's hard to make predictions, and it's always dangerous to make this kind of predictions. But definitely, we have to learn to live with COVID, as was already stated. We are now in the situation that we have a new strain which is more infectious than the previous, but does not leave such severe consequences, meaning that our health systems are not so under pressure as they were before, and we have to take into account all of the factors and all of the objectives. So also the fact that we need to maintain the economy, we need to maintain value chains, supply of critical goods and materials. So I think that definitely some kind of complete closures are not an option at the moment. That is important, because if you also go too far in restrictions, we also learned part of that lesson. You can also have counter effects in terms of other diseases, mental health problems, mental health issues, delays in people getting diagnosis for non-communicable diseases such as cancer that you mentioned, but also some other things. So if we go too far in the direction of restrictions, the final consequences can be counter-effective. So we kind of have to try to learn to live with COVID, but try to balance all of these different issues that need to be taken into account.
Anka, Toma, you represent the people who are at the very center of all this, the patients. From your perspective, how do you see the development of COVID so far, and what is important for you?
I would use an emergency room type of analogy, where I would say the situation feels critical but stable, which is the first step towards improvement, right? It's been critical for a very long time, and this disease has affected our community of patients in many, many ways. Thankfully, it's stable, and it is stable because vaccines have been available, and clearly they work. That the social distancing measures have stuck. People are more careful now, so there's a personal behavior element that has been adopted. That masks clearly are helpful in preventing transmission in crowded places. So we are in a point now where we are feeling ready to live with this for a very long time. We have just had at EPF, we've just had a congress last week for 2 days in person, 150 people. What we've done, because a lot of our attendees were patients themselves, so we've ensured additional social distancing, we've recommended masks, and we've been in a situation where we did not have a super spreader event. So it's quite clear that even in the patient community, we are able to live with this, and there's from the social point of view, from the mental health point of view, it is time to go back, to go into a more social, in a social setting where we interact a bit more, and where travel restrictions are just not okay with our community anymore. We need to go into society. I wouldn't say back, but forward.
Okay. Eleonora Vartumian, you are president of the European Health Parliament, which brings a huge experience to the table. Based on your work there, how do you see things going forward? And maybe tell us about the European Health Parliament.
Yes,
I guess that many people out there in live stream land don't know about this.
Of course. The European Health Parliament is a multidisciplinary platform. Each year we gather 60 young professionals to develop policy recommendations upon consultation with the European Commission. So we tackle some of the burning issues in Europe. This year we have topics from digitalization, prevention, sustainability, future-proofing healthcare systems, and well-being of healthcare workers. And the main aim for this year is to create a resilient European Health Union by recovering, reinventing, and reinvesting in health with a think patient, think digital, and think sustainable mindset. So this is what we are trying to achieve. I would say to absolutely follow our website and see all these young dynamic people, what we are doing right there. We're all working in healthcare. We're passionate to bring a change with the support of members of the Parliament, the Commission, and civil society, so we can create a better European Union, which is leading in this area for our generation, but also for the next ones.
All right. It has been 2 years now that we all have been living with COVID, yet we're still experiencing wave after wave of COVID, some bigger, some smaller. What are the main lessons learned for the EU, for lawmakers, pharma companies, doctors, patients? Do we learn new lessons after every wave? I want to start with Mr. Sokol here.
So I think the first lesson is that we actually need common health policy. So that that this COVID pandemic has showed us that there are some health issues which member states cannot resolve that by themselves. And I'm mentioning this because in the past we usually the excuse for not having more action on EU level was the fact that the healthcare is primarily national competence. It is, and the fact is that we didn't have a real common health policy, systematic health policy before. It was kind of always ad hoc solutions to some things which emerged, like cross-border healthcare cases and then the directive, etc. But we didn't. There was no systematic common approach on EU level. This has changed now because we now see that these big public health issues, big pandemics, cannot be resolved by member states themselves, because pandemics like this do not know and recognize borders. So we need common Europe, and this was proven in the first months. So when we didn't have common European response, we had border closures, export restrictions, lack of medical equipment, etc. So to prevent this from happening, we need more coordination. We need common European response, common European rules, what to do in these kinds of situations, common protocols, common common stockpiles of necessary equipment, and we also need a stronger institutional framework, which has already been developed by the creation of HERA, by strengthening of the mandate of the ECDC and EMA, European Medicines Agency. So this shows us that really now we have this chance and this possibility to strengthen this EU framework to be better prepared for future crises. What is important is that we don't lose the momentum, because healthcare was traditionally on the margin of the interest here in Brussels. This has changed primarily because of the pandemic, but also because of the Europe's Beating Cancer Plan, which was the initiative started in 2019 by Manfred Weber. But now we already see that this momentum is already shifting towards other issues like Fit for 55, war in Ukraine, obviously. So what we have to do, and this is why initiatives such as European Health Parliament are good, is to really keep the focus on health issues here in the Parliament, here in the Brussels bubble. Not just on COVID, but also on non-communicable diseases, on heart diseases, on mental health that I mentioned, because all of these people who are suffering from these diseases have suffered additionally because of COVID. We have to see what to do to help them and to develop common European strategies on actually how to better treat and better prevent these kinds of diseases. Because as we cannot harmonize, we cannot unify healthcare systems on EU level. We cannot, because funding and organization, financing of healthcare systems, definition of health insurance packages is a member state prerogative, but still we can do a lot to actually help member states and support their actions and to resolve problems which exist also on the national level. And also one thing which is very important is to use whatever we can in the EU, from the EU budget, EU for Health program, cohesion policy, recovery and resilience facility, to try to mitigate the differences which exist in terms of the standards of healthcare provision in different member states. So there are much bigger chances of you dying from cancer once you're diagnosed if you live in certain regions of the eastern part of the EU than if you live in Belgium or the Netherlands, for instance. So this is something which is unacceptable. This is why we have to actually work, and I was a rapporteur in the Committee on Regional Development on how to use EU funding to relieve these differences. So we also have to work additionally so that there are no first and second class citizens, but that all citizens of the EU have at least similar standards of healthcare provision.
All right. Anka Toma, lessons learned for patients and doctors, what are they?
I think the most important lesson for our community was for our community or for society with respect to patients is it really brought the spotlight onto the vulnerable people, the people most affected by this pandemic. So you had the people who had worse severity of disease because they had comorbidities. You had people at higher risk because of various inequalities in society, health inequalities, socioeconomic inequalities. And then you also had the clear society inequalities that have to do with vaccination, vaccine hesitancy, and a lot of these also highlighted some of the pre-existing challenges in health. So from purely the patient's perspective, I think highlighting the vulnerability of people was very, very important. The second thing that we saw was that health systems that were already fragile, they really buckled under the pressure, and our community reported to us delays in access to care, delays in access to diagnosis. I mean, these I hope they are already known, and if they are not, there were huge delays for a lot of our patients. So there were a lot of indirect suffering, illness, death that were caused by the fact that people weren't diagnosed, that they didn't have access to health professionals because health professionals were suffering with the crisis. So that in turn is the opportunity to rebuild, to build back better. What everyone says, we need to rebuild the health systems in a way where equity of access is a fact, not an aspiration. We need to build that. So from our perspective, what's really good is that there's finally health at the top of the agenda. Yes, there's a lot of other important things, but health is really important. That together is better, and that finally health is being resourced a little bit closer to what it should be. I'd still say more, but you know, we are coming from a health program where every penny was counted, where we were looking for bits and bobs everywhere to fund health initiatives. And now health also has a budget, which is just, it's amazing, it's incredible, and it's right.
Eleonora Lacunyan, you were nodding several times.
Absolutely.
Now you're at the Health Parliament. You're thinking about solutions, and obviously this needs to be done after having recognized the lessons or detected the lessons. So, can you speak to that?
Yes, I think when the COVID-19 pandemic happened, we were not prepared as we would have because we didn't have a lot of information about the new disease. I would say it also takes a lot of time to educate the population about to follow sanitary measures, to listen to the authorities. So what I can see right now is we see an increase on digital tools. So we can see that self-care is prioritized. We can see healthcare workers investing more in digital skills. So we can say that the digital transformation is actually happening right now. And this wouldn't be possible without this experience that we have gained. And we can leverage on that because Europe has so much to offer in this area. NCDs as well, MEP Sokol said, they caught a bitter attention because people were not having access to primary care because they were actually neglected in the hospitals because of in one night the hospital became like emergency rooms because of all these many cases. So what I would say that we have increased definitely cross-border collaboration. The European Commission has done a great job, especially with negotiating in terms of access to vaccines and for the member states. So in this way we can see how EU member states and at the EU level, how we can support national members to make decisions and actually improve the policies that we have in place.
And Sandra Galina, the question about lessons learned, we've heard that question many, many times. And yet we're still going through wave after wave after wave. Do we learn particular lessons after every wave?
Of course. Human beings always learn lessons. I would say that under the leadership of the President and also the Commissioner, what we have seen is that the vigilance is never enough. And so the first lesson after every wave is that perhaps a bit of more vigilance can be helpful. Second thing that I would like to say is that what we have learned in these successive waves is that, of course, without health, there isn't a social life, there isn't an economic life, so health comes first. But beyond the words, we want to see now the facts. The European Commission has been helping member states in putting the priorities right when it comes to the RRF. So these funds, the Recovery and Resilience funds, should help to boost the public health systems in their fundamentals. So if you allow me, we have, from the first waves, we have learned how to be prepared against the emergency, but now we need to go beyond that, transition out of the emergency and build resilient public health systems. Now, to arrive there, it will take a bit of time. It will take also a bit of investment from, I would say, the top, from prime ministers, from the heads of state and government, because let me say, what is clear is that the pressure of many other emergencies which are equally disastrous, like the Russian aggression on Ukraine and all of this. It's not that, they take their space because they are so huge, but health is still a priority in the minds of leaders. I can see it from the president. My commissioner is attending every G7, and I can see that there is in G7 and in G20 a huge attention to this. What is impossible humanly is to have all priorities at the same time. So let me say, what we need to watch is that the health priority does not slip. So I count on the politicians, I'm just an official, I count on the politicians to keep health very prominent on the agenda, because the investments for, I repeat, the long term, the sustainability of public health systems, and here a word for the workforce. Patients suffer because, let me say, not only structures or investment is not at the right level, but also because the workforce needs to be trained, recognized, and rewarded. The disparity in terms of salaries of the health workforce in Europe is there. It's, as Honorable Sokol said, this is a national competence, but at the same time, we are all human beings, and there should be a bit more equity. So for the long term, I sense that health is a field where disparities will no longer be tolerated by patients, but also by the people who work in this sector. And I think that industry has also come a long way. It's a lesson that they learned is that, a market of many millions of people will also want to be treated as a single market, because we have seen, and I hope in the pharma strategy in the future to address this issue, that not all medicines are available everywhere, and this is something that should sort of change. Let's hope.
I want to bring up one point that was very important for people during the pandemic, the impact of the pandemic on other disease areas.
Oh, yes.
Screenings, surgery,
Huge.
treatment. What was that impact? Are there any data that suggests a major problem in particular fields? And do you have any examples, Eleonora?
I can speak about cancer, the statistics that we have. Of course, we have to invest a lot with healthier lifestyles. So when it comes to access to nutritious food and when it comes to tobacco and alcohol control, we would see some countries have higher risks when it comes to alcohol consumption, and some of them are on tobacco control. So this is exactly where we need to step in and make some interventions to help that. The situation is deteriorating, unfortunately, especially...
It still is.
It still is, and we expect to even grow these numbers because a lot of cases went undiagnosed because these people were not, they postponed the treatments and the screenings. So right now, this is exactly what needs to be done to prioritize these disease areas. I'm glad that the European Commission has cancer top on the priority. It's one of the biggest issues we have in Europe, with many incidents to increasing. And I believe that if we invest in this sector, and also civil society, patient organization, let's work with our national society so we can implement what the European Commission delivered to make it implemented and actionable in our member states.
Anka.
Oh, let me show you, because what we've done is we have surveyed our members. So EPF has now 78 members across the entire European region. And a couple of years ago, we've asked them, how has the pandemic affected you? So let me tell you what they said, because it's really alarming. 95 of our respondents, which is patients across Europe, have had some kind of challenge. So basically, almost everyone had some kind of challenge. Most of them reported stress and anxiety. Also, most of them reported social isolation, treatment delay in 50% of patients, or discontinuation. People who were under treatment who stopped. About 1 in 8 stopped their treatment. So there you go. Information and communication from national authorities were less than perfect for a good third of our respondents. There was an impact on employment. So patients were affected in many ways. Some are very distressing. And I would say, and we are going to repeat this survey this year, so 2 years on, we're going to ask them again to see how it evolves. But from what I perceive, mental health impact is something that we really need to focus on. We really need to look at because there is a collective trauma from this.
Tomislav Sokol, you've heard this. The situation is apparently not getting better, at least immediately. What are your observations here? You're particularly interested in cancer.
Yes, but it's not just cancer. For instance, I've had a lot of discussions with people suffering from other non-communicable diseases, for instance, from heart diseases, but also from other types. Also on mental health, we had a lot of discussions and a lot of events also on the impact of the pandemic on mental health, and the situation is definitely not good. I think it is, at least in my country, I can say that now it's better. At least now the health system is kind of picked up some of its regular activities. So in that sense, there are no new delays, but we have a big backlog that we have to fight from the last couple of years. And of course, we don't know exactly what will happen in autumn. So we have to be prepared on that. So this is a big problem, but this has highlighted the structural problems that health systems, national health systems, definitely suffer from. And I think that equity is here one of those crucial issues and one of those crucial dimensions where EU can provide this added value. For instance, when we speak of workforce, of course, we speak a lot about investing into infrastructure, equipment, etc. But without investments into workforce, there will not be a result. Especially, we have to improve working conditions for them, create retention strategies, because this problem of brain drain, especially in some areas of Europe, is really dire. And I know from my country, the biggest problem, of course, was, I think it's most of these countries, in the first couple of years after they joined the EU, not so much after that, but there is still a continuous emigration of health professionals, especially doctors, in some specializations, but also nurses. I think that also we do not discuss a lot of the problem of the lack of nurses, which in some countries is even bigger than the lack of medical doctors. So we definitely need to use European Union more. So we need to use the cohesion policy more. The cohesion policy, which is the aim of which is to reduce differences in terms of levels of economic development and living standards across the EU. We need to invest both into infrastructure through ERDF, for instance, European Regional Development Fund, but also to use European Social Fund more to fund the new specialization, subspecialization, specializations, university programs for higher education in medical professions, because this is the only way to relieve these problems which exist. But definitely, what is important is that we have a continuous European action, which also means that we create permanent structures, permanent budgetary sources of budgetary funding, primary permanent institutions, new institutions like new agencies, strengthening the existing agencies. If we want to have this, if we want to maintain the focus and to have this continuation of European action in the area of healthcare. EU for Health program is one good example. It's 12 times bigger than the previous budgetary program for health in the previous budgetary period. It's not as big as we wanted in the Parliament. So we wanted more than 9 billion euros. Now it's 5.3 billion euros. It was a compromise, but this is definitely way forward, and we have to continue that direction.
Are European health systems prepared for the next pandemic? And what need to be improved? Sandra Galina.
Oh, a very challenging question. So let me say, in a nutshell, they are getting prepared. So I would like to underline what was said at the end by Honourable Sokol. It's the long term and the sustainability in the long term that is the challenge. Because what I saw is that there is the 100 flowers, as I call it. After COVID, there have been many laudable initiatives to give a sort of response. And I would say that the big boost that we had in digital was part of that. Now, this needs to come out from an ad hoc sort of approach and needs to become something more stable. So some member states are better than others in giving sustainability and long term, so that the waves of COVID will come. As I said earlier, we need vigilance, responsibility, we need to live with COVID. But at the same time, our systems need to be resilient for other diseases. I mean, we cannot leave the non-communicable diseases behind. Let me say to all of you, this year, I would commend the read of a yearly publication that we have with OECD. It's called Health at a Glance. You will have absolutely all the figures, so I would not be able to tell you how long the delay was, I would say, because we are still waiting for the data of 20 and 21. So this year we will collect them in the publication, and we will see. For some member states, we are in really a matter of the backlog not being, for 2020, not being disposed today. So this is where Europe comes in, and I would say there is a variety of funds, from cohesion to social fund to the EU for health, all have been just mentioned. But let me say what I see is that we need to avoid a duplication of easy actions in the things that, may I say very crudely, get votes soon. So for instance, it is clear that opening hospitals, giving more machines makes people feel safer, but what would really be helpful is prevention, prevention, prevention. I will insist. This is why in cancer we will add new screenings, as screenings that are more or less mandatory, because health is not the state of absence of diseases, is your normal state. So people need to come to the conclusion that there are health determinants, from tobacco to alcohol, to, I would say, movement and nutrition. Movement, physical movement during COVID was quite difficult. So in the long term, if we have to live with COVID, even a small aspect such as how are people keeping up with their mobility in terms of movement, elderly, young people, it's an aspect that member states need to cater for. So I think they're getting prepared. There is a willingness. I repeat, I think all leaders are aware that health is a priority, but other priorities are eating a bit of the space. But I am an optimist, and the money is there and the will is there. It takes a bit of also work to put the programs together.
When I think of preparedness, I think of vaccinations.
Of course.
And we've seen a big problem with vaccine hesitancy. And there is a sizable part of the population that refuses, for whatever reasons, to get vaccinated. How can we as society deal with that, Eleonora?
One of the biggest challenges is actually the fake news that were ongoing. We would have people even questioning if the COVID-19 pandemic existed or not. So I would say Europe has to have a better control over what is circulating right there. Again, as I said before, it was also about the misinformation that we had, like COVID is transmitted in closed areas, in open areas. I would say that we weren't coordinated in this. And when you have this misleading information, of course, this creates hesitancy to the general population. So what I would say in this case, we need to create trust to the public when it comes to vaccines. It also has to do explaining the added value of this, because I felt like we said you should get vaccinated, but we never elaborated on why. So things that are so simple, taking into consideration also the different inequalities in member states and different educational level, we need to reach to these people and explain to them. So it has to do with a lot of cultural transformation, creating trust, open communication and collaboration within EU member states. We have the commitment, as you mentioned correctly. We have the finances. Let's sit together and I think that everybody now wants to sit around the table and talk about the creation of European Health Union. Now is the momentum to build on this hesitancy, and then we can progress all of us together.
I want to talk about the European health data space, something that was launched before COVID, but has certainly accelerated. What is it exactly, and what benefits can people get from it? Patients, nonetheless. Anka Thomas.
You're starting with me. It is a Commission initiative, so I'm pretty sure Ms. Galina is going to have a lot more to say about it. It was about time. In short, it was about time, and we have seen the pandemic accelerate the digital transformation of healthcare. We have been, as a community, looking at this very closely. We very much welcome the proposal of the European health data space, and we will be very happy to work to support the Commission in the next steps, which are going to be not easy and not straightforward as any legislative process. We have seen that the proposal for the health data space is built around patient needs, which are access, privacy, protection, but also a fundamental objective to advance health research, to advance innovation, which are things that our community needs. Really good developments. We would like to see a little bit more patient centricity in it. We'd like to be involved in a bit more of a structural way in how it's run. But I'm sure that is something that we will have plenty of time to talk about. So good news in that, and it's really.
I think that Sandra Gagini likes to hear that.
Oh, I love it.
What are
I
the
love
benefits for the, and what are the critical points where it's not
yes.
yet?
Oh, yes. So, first
Totally
of all,
resolved.
data sharing saves lives. This is important. You bear in mind that we are sitting on a pile of data that can be extremely helpful. You can have that by experience yourself. When you have an ailment, what do? You first start with a small talk with a friend, and that is already something interesting. But I would like to say that it is extremely important that we realize that health data are very sensitive, are more sensitive than even normal data. So there is this first element that we need to bear in mind, that we need to do this in a securitized environment and in an environment where there is trust. And it was a good omen you started with patients, because the real aspiration I have is that at the center of this proposal there is the patient. We're not China, we're not the US, we will be Europe. We have the GDPR, but this is, I would say, an area which is even more important for the citizen, because it's about your health data. So you need to be empowered at any time to be able to say, I want my data to be used or not. At the same time, the challenge is that we need to have small researchers enabled in their research, because what we have at the moment is that perhaps bigger boys have the ability to have the data, but the smaller ones, the small university researchers, we are talking here in jargon, they say secondary use. Secondary means after the hospital, let's simplify, where your doctors are looking at your data, the second gaze of the data, who is allowed to have it. So this is going to be an area of huge discussions, but I can sense that the time is ripe now for, I would say, a very mature approach to how to share the data. I think that at the end of the day, we have, I would say, an overall expectation that this health data space will be at around 1 billion in terms of cost for the EU. We have a budget. The real art will be to somehow have member states relax, because all of them come to me and say, I have my digital thing. I'm not going, look at the digital pass, I'm not going to change your system. What I want is interconnection. First of all, I want a smart card, if we can call it like that. A patient needs to have its own record here in its pocket, go everywhere in Europe, get the same medicines. So it's about a bit the roaming of health. Think it about more the roaming of health. Yeah. And then, try to finance, from our point of view, these connections, which, of course, the member state with the RRF will do the work inside the country, but the RRF does not provide for the final mile between the member states.
If I may interject here briefly, I think the main issue that people have with this, or the main thought is, can I trust that my data will be protected?
I think
Do I put data out there and everybody has access to it?
No, exactly.
What do you say?
That is not the idea. Let me say to you, the platform that we are talking, I would say internally, is something a bit visionary, in the sense that, of course, there will be a certain level that can access these data, and it will be a level that will be established in conjunction with the discussion with the Parliament and the Member States, because here we need to see who is actually a person who can or should have access to your data. But let me say, the most important point of this platform will be the centrality of the patient. You will be able at any time to access a platform which will show where your data of that certain disease or period in hospital, it can be any sort of part of your health life, or let's say non-health life, and is used by whom, or is, at the same time, we need to understand that having a very cumbersome system where the patient needs to actively somehow allow this is going to be particularly cumbersome to manage. So be trustful that the data you will access who can, and you can stop that. You need to be able to say, my data will not be used by that. Imagine you have a particular specific phobia about a certain thing. You say, my data, I don't want them to be used there.
This system is a great transition to my last question and the final round. And I want you to be precise and short and thoughtful. The pandemic has shown that Europe has become a much stronger health player than it was before. Is this going to continue? And what needs to be done? Is it desirable? What are your thoughts on that, Eleonora?
Yes, I absolutely agree with this statement. I think we are experiencing right now the great resignation. And what we observed is that if member states need to tackle even issues of mobility of the workforce. So for that, right now, we can see that EU member states collaborate closely together, which is a great sign about the future. And then we can see that when Europe acts together, we can have better results. Member states, by their own, they cannot act, and this is how also we can bridge the inequalities that we have, especially when it comes to central or southern part of Europe. They need support in certain areas. And this comes from workforce issues, from access to digital tools, for education training. There are so many areas that some countries are a bit behind, I would say. And if we collaborate together with the support of members of the European Parliament, the Commission, and civil society, then we can progress into the creation of a real European health union.
Great. Let's throw it to the sole member of parliament at the table.
Thank you very much. But
Tomislav.
first, I would like to comment because I didn't have the chance on health data space. I think that's definitely the most important piece of legislation, concrete legislation, that the Commission will come up with in this mandate before 2024. So I think it's very important because currently the problem with data is that in different member states we have different standards, different protocols, different ways of interpreting GDPR, and all of this is creating problems and obstacles why we cannot use this data in cross-border settings. So we cannot exchange data, which means that we cannot, and it's harder to conduct cross-border clinical studies. It's harder to have European reference networks, cross-border reference networks functioning. So all of this potential cannot be realized because of the lack of interoperability of data. This is the primary reason why we need this health data space regulation. I have to say, unfortunately, in the Parliament, we still cannot agree on which committee will be the lead committee on that. I think it should be the Committee on Public Health, the ENVI committee, which I'm a member of, but we still cannot get the agreement on that. And because of this, unfortunately, I think that the decision-making process within the Parliament will get a bit delayed, I have to say, but it is as it is. But I think it's very important, and I think that I hope that we will be able to resolve this as soon as possible. When we speak of European Union role in healthcare, definitely it has increased. It has become much more important than it was before. Now we actually have contours of a real common European health policy, so systemic solutions. We have the pharmaceutical strategy, the Europe's Beating Cancer Plan, the EU for Health program, the RRF, where healthcare is one of the priorities. We have healthcare as one of the priorities within the New Horizon, which is very important for research and innovation, that fundamental research which must be funded by public purse because there is no commercial interest in that, but which is the basis for all subsequent research and everything that comes after that. So definitely there is a lot of things that are being worked on at the moment, health data space as well, revision of pharmaceutical legislation. Also, one thing that we didn't mention, which I think is also important, is to strengthen the EU framework on cross-border healthcare, because the current system, we have two different sets of rules which regulate the same thing. It's very unclear, very non-transparent for patients. You need to be health law experts to actually know what your rights are to get healthcare in other member states if you cannot get adequate healthcare at home. And this is something that definitely needs to be strengthened and made much more simplified for patients. And I think the Commission has made a revision of this cross-border healthcare legal framework very recently. What they come up with, I think I have to say, we cannot agree on everything. I think that they should be a bit more ambitious than what they are mentioning there. I think that we need to unify the rules on reimbursement of this cross-border healthcare. So instead of having two sets of rules, to have one clear set of procedural and reimbursement rules for this cross-border healthcare, so that patients who cannot get adequate treatment in their own member state can get it in any other member state of the EU. So I think in general there is still a lot of the road to go through, but definitely a lot of improvements have been made. We have to maintain this focus on healthcare as one of the priorities, and I think that these kinds of events like European Health Parliament and these kinds of interviews and these kinds of media campaigns are really helpful for that.
That's nice to hear. Anka Toma, Europe as a health player, is that beneficial for patients?
Is that the rhetorical question? Because of course, and I was taking some notes now, thinking back of your question. Yes, Europe is a global health player, and it's probably a leader in health. And that is because of the good news that are coming out from this pandemic. We have reached a point where the conditions are really favorable, like really, really favorable for three things that can make it happen. One is the realization that multi-stakeholder cooperation is the way to get things done. The second one is the patient centricity of policies that are now being developed, and we recognize these intentions, and we're ready to work with the European Parliament, with the Commission, with the Member States to make sure that that actually reflects the needs of the patient community. But let's just make a little disclaimer here and say, when it comes to health data, everyone is a patient because everyone has health data. So we're not talking about the 150 million patients with various chronic diseases, rare diseases that we represent. We talk about all the citizens of the EU. I'm going to close that parenthesis. And the third good news is the digital transformation. So yes,
right.
health player, leader in access, leader in outcomes. This is what we want to see.
Okay. We're running out of time, but Sandra Gallina, one short comment on you. Obviously, you must be happy hearing this.
I'm very happy. I would like to say, yes, we are a big player. By necessity, we became a big player, which is a very sad story. We could have been a big player earlier because we had universal health coverage, which others don't have. So we are strong. We have a pharmaceutical industry that can, give you all the medicines you want. We have, I would say, hospitals that in the ERNs, the European reference networks, sort of put out advice on the rarest of diseases. I'm sometimes surprised. So we have it all. We have the political will. I think that Ursula von der Leyen put her stamp on this mandate with health. Health is at the core of this mandate. Whether we liked it or not, we are in and we will continue to be leaders.
All right, and on that optimistic note, thank you very much for watching us out there in live stream land. Thank you to all the panelists. It was a very interesting discussion, and I think we've learned here and there some things. Thanks again for the European Parliament for hosting us, and goodbye.